Hi, good evening. Austin Mayor Steve Adler. You got a minute? It's been a while with the weekend and yesterday being a holiday that we've gone over numbers. We'll go over numbers. We have a lot of charts tonight because it's Tuesday, and Tuesday is the day when Dr. Escott and Director Hayden give us a lot of information and data for us to be able to go over. Now, U.S. deaths have gone over 400,000. I remember earlier in this pandemic when some of the experts were suggesting that we might go over 200,000, and there was a big debate about whether or not that was a number that was being said just to scare people. As it turns out, if only it were 200,000 people that had passed away. But in any event, over 400,000 people. President-elect Biden, Vice President-elect Harris are commemorating the lives that are lost. They have lights that have been lit at the Lincoln Memorial reflecting pool. I've seen some pictures, both beautiful and somber. I don't know if City Hall and the Long Center will shine lights tonight. I think we asked them to. But wherever you are, tonight might be a good night to light a candle in honor of a family member or neighbor or loved one that might have passed away. Strike a match, flick a lighter, turn on a light in a room that you might not otherwise have turned on. Let's go take a look at the numbers, and let's begin with the chart that we look at. Let's see here if I can get to them. All right, so this is the first dashboard that we use. You see there's 114 new hospital admissions in the red in the bottom left. That number is substantially above the 88, which is the 7-day moving average. That's a concern. We have seen historically after a weekend that the numbers on that first day back are ordinarily higher than trending would normally indicate. People get sick, maybe need to go to a hospital on a weekend, on a long holiday, and they just don't want to go because they're with families, so they wait till the next day to go. You shouldn't wait. You should go to the hospital even on a weekend. But it may be that the 114 is artificially high because it's the Tuesday after a long weekend. But in any event, that number is of concern. Of concern is the number of new cases we have today, 834, significantly above the 7-day moving average of 680. That number is substantially higher than the numbers we were seeing over the weekend, which could be just an anomaly again as we leave the long weekend. So the next day or two are going to be real important to us. The most important number on this page for me right now is the 12.8% in the bottom left-hand corner. That's the positivity number. You'll recall that last week the positivity rate among people taking tests was 16.2%. It's dropped to 12.8%. Over 20,000 tests given last week, so that's a good solid number of tests. That's the first number that we would see going down if, in fact, behavior changes were working in our city in such a way as to change the trajectory that we're on. That doesn't mean definitively that that's happening, but that is a good sign to see that number come down to 12.8%. We should see that being translated into the numbers of new cases and new hospitalizations. So let's pay real close attention this week. But on this page, conflicting numbers, 114 high, 834 high, but that 12.8% is a really important number for us. Let's take a look at the other dashboard that we have. This one is the Austin Travis County dashboard. You can see the deaths at 600. That's up 8 from yesterday, which was 592. 8 families today that are mourning the loss of a family member. We did a really good job keeping our mortality rate low with this spike. We're seeing an increase in mortalities. The more people that get the case, get the virus, the more people that end up in hospitals, the more people that end up hospitalized on ICUs and ventilators, and the more people that die, which is why we need to keep the infection spread as low as we possibly can. Look at the numbers, the green numbers, 602 hospitalized. The 7-day moving average is 605. So that's a good number. Number in the ICU tonight, 176. The 7-day moving average, 182. So that's below the 7-day moving average. Ventilators, 106. 7-day moving average, 104. So those would indicate kind of a leveling off. So based on hospitalizations, ICU ventilators, based on the infectivity that we have, the 7-day moving average on admissions on that last one was 88. That's remained pretty flat. We'll take a look at those in a second on Dr. Escott's charts. So let's go ahead and do that, get some indication for where we might be. So I'm going to pull up the University of Texas modeling. Well, let's start first with Dr. Escott's charts that he presented here, and let's see if I can do this in a way that let's see here. I don't think that's the one that I wanted. Let me try this. Let me try this again. We'll share the screen. We'll go to the Chrome tab. Let's see here if this will work. All right, so here is the first chart we want to be taking a look at. This is the number of new confirmed cases. You can see the yellow line, which is a 7-day moving average. The blue line off to the right is the actual daily number. This is good up through yesterday. You can see we're still headed up on the total number of new cases, which is obviously a concern. Let's see if we can get to the next page. This shows you hospitalizations, the blue line off to the right. The orange line in the middle is ICUs, and the gray line is ventilators. You can see that the blue line in new cases is kind of faint, but if you can see it, it's starting to level off after a pretty dramatic upward increase. The number of 7-day moving average of ICUs, which is the orange numbers, were headed up, and in a hint that they might be leveling off. Ventilators, a hint that they might be leveling off. Still real early to see, but certainly some indication of that. This is the chart that shows us hospitalizations by age group, and you can see the 4 numbers that are off to the 4 lines that are off at the top and off to the right. Those are folks 80 and above, 70 to 79, 60 to 69, and 50 to 59. So really, that's your group of 50 on up. Are the greatest percentage of those being hospitalized. We know that. relates to age. The next group in the middle, the green line, the blue line, and the yellow line, that's the percentage of people hospitalized, beginning with 20, going through the 20s and 30s and 40s. That's a fairly high percentage. And again, it just points out, even if you're in that age group and aren't going to end up in the hospitals quite as much, still a lot of people in those age groups carrying the virus and can infect others. Percentage of people in the hospital in the last three groups, those are the children that we see at a much lower percentage. This is the number that shows us hospitalizations by age group, just in a little bit different form than what we saw just a second ago. You can see that the number of people 80 and above that were hospitalized by age group this week, which is the line all the way to the right, has gone down from 98 to 90. That would be a good sign, but the number of 70 to 79 has gone up from 98 to 119, 60 to 69 in the 60s, going up from 110 to 120. It's really the age groups, beginning with the dark blue, that you can see are consistently having lower numbers. Let's look at the next slide. This is hospitalizations by race and ethnicity. The blue line is a white, non-Hispanic. The green line is Hispanic. The Hispanic number has gone down the last 3 weeks, down to about 38%, just above what it is in the population generally. Percentage of people hospitalized that are white, non-Hispanic, going up. The number for African Americans, which is the gray line that's kind of in the middle, remaining relatively flat at about 10%, which is on a percentage basis significantly higher than the 7% that's in the population. This is hospitalizations by race and ethnicity. You can see that the green at the top, Hispanic, all races, has gone down from 195 to 182. That's consistent with the chart we were just looking at. The number of people white, non-Hispanics, has gone up from 208 to 224, and that's why we saw that number going up on the last chart that we did. This is the one that is perhaps the best early indication. This is the earliest indication we see when our behaviors might be impacting the numbers. This is the positivity percentage by week. Each of those bars represents a week. The most recent week, this past week, is the one that's all the way to the right. You can see that the positivity in our community was rising considerably, 3.7 all the way on the left-hand side, which is where you want to be. You want to be under 3%. Rose over 5%, continued to rise all the way up to the last 2 weeks ago and 3 weeks ago at 16.7 and 16.2. That's why we're seeing numbers. That positivity in those weeks would show up as hospitalizations about now. The 16.7 takes about 14 days for something about 14 days before somebody who is initially infected goes into the hospital. From the time that they're tested and get the positive result, maybe a week to 10 days. So the numbers that we're seeing in our hospitals right now represent the 16.7 and the 16.2. As we go into the week, we'll start seeing numbers in terms of new admissions that might be more reflective of the 12.8. If that's true, then we would start seeing those numbers going down. We can take another. That's the chart that really looks best for us. Let's go ahead and take a look at the positivity number based on race and ethnicity. Each one of those clumps of colored bar charts, there are 4 of them, represent a week. The most recent one is the one all the way to the right. And you can see that the positivity is going down with the peaks, everybody under 20%, which is really good. It's the Hispanic Latino that still is the one that's most out of line. That's that gray line that's in the middle. The white population is the purple line off to the right. The African American is the kind of the gold line. That is the gold bar that is in the middle. You see the red dotted line, that's 5%. The green dotted line is 3%. That's where we really want our numbers to be. The number that's gone up here is the American Indian or Alaskan Native. Not a lot of cases, but on a percentage basis, ranked high. This is the same kind of chart, but rather than being based on race and ethnicity, this is breaking it out by age. And you can see that where we have our highest infectivity or positivity rates is off to the right. Those are the folks that are oldest. The kind of the green line all the way to the right is like unknown age. Folks over 80 are that kind of pinkish line. And it works from right to left as you get younger. The gold line that is sticking out is 10 to 19. So the positivity rate among people 10 to 19 is higher than the trends around it for age groups, which is, again, people 10 to 19 aren't going to have probably serious complications, odds are, but they can certainly affect other people who would. What that's showing us is the positivity of school-age children. This is not the positivity of everybody in the school, just among those that are taking tests. High school, 17.9, down to preschool, which is 12%. These numbers, like the positivity rating overall, are lower than the numbers that we had been seeing. Stage 5 recommendations, real important. No gathering with anybody outside of your household. Dining and shopping limited to essential trips. Avoid non-essential travel. Businesses recommended to operate through contactless options, curbside delivery, and the like. But the rest of us, we should make use of those. Buy some takeout, some delivery, so that we can help in this economy. Restaurants that are really hard hit. Most importantly, mask when you're around other people. When you're around anybody not in your household, you're going to put a mask on, keep it on, make sure that you social distance. This low positivity rate that we're looking at right now could be a really good thing, but we need to double down and keep it and keep it going to see if we can really build on that, make that real. Let's talk about vaccines a little bit. We need to get to the place where 70% of the folks in Travis County have received the vaccine. The vaccine we're using right now, Moderna and the Pfizer, require 2 doses. As we get in out front months, 3, 4, 5, 6, we could have other vaccines that we're using in the community. Maybe some of them will only require 1 dose. But in any event, we need 70% of the people in Travis County population in order to get to herd immunity. If we get north of 70%, then odds are the virus is going to be dying out in the city, just because it's the chances that it's going to find a host that it can infect go down when 70% of the folks are vaccinated, which means a lot of the virus just dies out and doesn't get passed on. The initial distribution of vaccines around the country has been slower than anticipated. Around the state, slower than anticipated. Here in Travis County, every vaccine we get is being put in somebody's arm. And we're getting and using and administering all of the vaccines that come our way. There seems to be some obviously uncertainty in the community about when it is that they're going to be able to get vaccinated. We have gone through some of the most important people to vaccinate first, our hospital workers, our first responders, because we're asking them to actually go be with people that are infected to keep the rest of us safe. That's 1A. 1B are primarily people over 65. There's about 225,000 people, I think, in that category, 1B. We've only given out about 20,000 vaccines, so we haven't really been able to put a dent, and a lot of those have been the 1A people. So we really haven't been able to put a dent right into the people that are over 65 and deserving of and eligible for the vaccination. We need people to be patient. This is a supply problem more than anything else. It is a supply problem. We'll be trying to get it out. We hope we're getting more vaccine. We can't predict from 1 week to the next how much the state's going to give us in an allocation. We've reached out to the state saying we can do 2, 3 times, 4 times as many in a week if you'll give us a chance to do that. I just don't think the state has the supply either. We reached out to the federal government and said increase the supply coming to the states. We've reached out to the federal government, said send it straight to the cities and to the counties because we can get it out real fast to the people most in need where they live. And the hope is that we'll start seeing more supply, but we just don't know, which is why everybody needs to be patient. The virus that we get out, we're trying as best we can to prioritize that to communities of color and older adults, because those are the people when they get it that face the most serious risks, and by the numbers are the people that are disproportionately dying. We have a big facility we're planning for and can stand up really quickly, even bigger locations with, as I said earlier, 3, 4, 5, 10 times the capacity of what we have now if we could get the supply to be able to do that. But also looking at multiple small care vaccine providers in different locations in the city so that we could set up clinics in the area where people are most vulnerable to make it as easy to get it. Know that in order to be able to get a vaccine, you need to go on the APH website and register. I think there have been like 165,000 people that have registered so far. That means there are a lot of people that are registered that have not been told yet that they're eligible to get a vaccine. Some people went on the APH registration site when they go back to check or to look. They're getting an error message that says that their username, which is their email address, and their password don't match up. If you try to reset your password, that process doesn't work. But here's an easy fix. When you go to that site and you type in your email address, at the end of your email address, after .com or .org or .whatever that you have, .gov, whatever you have, type in .aph. So it would be like John Doe at gmail.com, add .aph. And I think that if you do that, you'll find that you can in fact get into the system and you can check and confirm you're there. But if you're in the system and you are over and you're eligible and in the next group that should be served over 65, and if they get more vaccine that they can make available so that people sign up, you'll get notice of that so that you can sign up. But the issue right now is that with so little supply, you could be going to that site many times and be told over and over again that you're registered, there just isn't any vaccine. Hopefully we'll get more, but be patient. I'm afraid you just have to keep trying to get on for when there is supply. If you go out to the location where we're giving the vaccination out, you'll be given a time and a location. Know that that time is set. Your vaccination is set to that time. It's not going to run out because your vaccination is set. But you don't need to show up early. Just make sure that you're there for when your time period is. We're having a lot of people that are showing up 2, 3, 4 hours early just to make sure that they're okay. But when they get there, they're creating lines for people who are showing up at that time to get their vaccination. So more and more, also Public Health is asking people who get there early just to sit in your car and just wait. And wait till your time for your vaccination comes around, and then you can get out of your car and then start moving through the process. Today, out at that site, it took 27 minutes to go from check-in to having your shot administered. After you have the shot, you have to sit for like 15 minutes to make sure there's not an adverse reaction. But 27 minutes from checking in to when the shot is received. We're using that Austin Salesforce portal We're using it for management because it collects information and data. Here it is, total counts required as of yesterday, 166,041. 60,000 qualify for the vaccine, 54,000, 60 years of age or older. It's capturing demographic data. The password error malfunction, it shows you, john.doe@hotmail.aph. So take a look at that. I think that's johndoe@hotmail.com.aph. But you might try that both ways just to make sure. We have asked the staff to give us the demographics so we can see exactly what the race and age demographics are of the people that are receiving the tests, as well as the people that are registering. So we can check and see if there's other tweaks we need to make to the system to make it fairer. But know that anyone in this state can sign on to get a test at any of the hubs, anywhere in this state. So people from El Paso could sign up for us, and heck, you could sign up for a hub in El Paso and fly out there and take a test if you wanted to. All that to say that there's a limit to the control we have to really target this to as finely and directly as we would like to be able to do. Austin Public Health received 12,000 doses last week. They received 12,000 doses for this week that we're giving out. We hope we'll get at least that amount for next week, but we don't know the answer to that yet. Distribution focus initially was on 1-8 people, direct healthcare staff, the COVID-19 response staff, the jail clinical staff, people that are not enrolled with a vaccine provider, but particularly vulnerable, hospice, that's long-term care facility people like nursing home staff that couldn't otherwise get shots elsewhere. By the 16th, we provided 12,600 vaccinations. That was Saturday. That was ahead of what we were expected to do at that point, about 1,200 more than what we were expected to do at that point. We did get some vaccinations out yesterday to teachers in independent school districts in our area, also charter schools and private schools. Got about 900 doses out to teachers in the area that were over 65. We have grants we're giving to many vendors that are out in the community trying to spread the word of what it is that we're trying to do and to get the virus out. And I hope that is helpful in terms of those data. Again, I think that I may have misused a word and talk about testing. Obviously, that whole conversation was about vaccines. But with the early indication of the positivity rate changing, and with the leveling off of the number of new admissions, because that stayed constant, and without the numbers today that showed a pretty substantial increase in admissions and in cases, let's go ahead and take a look at what the University of Texas is modeling for our city. It's showing an R factor right now of 1. That means the virus is neither expanding, it's staying the same. It's not, the virus isn't expanding, it's not diminishing. That's the 1 number. That's the lowest that we've seen in the modeling for a while. You can see the chart that shows us on hospital admissions and how the line's basically flat here to the right, that aquamarine line. This is the near term here. You can see that the numbers here locally, look at those green dots, widely variant, some really high, some really low. That's what's giving us that kind of flat line. Hospitalizations in the area, this was admissions, hospitalizations in the area. You can see the number again, just pretty flat here through February. We can take it through March. Again, you can see what the numbers are. The number of ICU patients, which was the concern, trying to stay under 200. If the numbers that we're seeing right now are accurate, then you can see how we stay just under the 200 mark. And that's what we're trying to do in the city. And you can see how that looks like it would be flat even as we head into the spring. But we want to do better than flat. We want to start pulling down this number, which is why we need to show the level of discipline with what it is that we are trying to do. Wear masks around anybody not in your family, social distance, avoid big groups. We'll touch base here tomorrow, see what tomorrow's numbers look like, see if they're in fact holding steady. Let's keep our fingers crossed, but more than that, let's do what it is we need to do to make this work. Hey, you all take care, be safe, and good night.